You can listen to this while resting or moving gently. Let it meet you where you are. This is a guide to pacing, one of the most reliable ways to make movement steadier when you live with chronic pain. It is not about doing more. It is about choosing effort in a way your body can recover from, so the next step stays possible. When pain has been present for a while, it often changes the way effort feels. You may start negotiating everything: how long something will last, how far you will go, and what it might cost you afterward. Some days you hold back because you are afraid of making things worse. Other days you push because you miss your life. Both reactions are understandable, but they can keep you stuck between overdoing it and pulling away. Pacing offers another rhythm. It helps you choose a level your nervous system can handle and repeat. Take a slow breath in through your nose and let the exhale be a little longer. Nothing needs to change dramatically. Just give yourself enough space to think clearly. With that little more space, bring to mind one movement that tends to feel loaded for you. It might be walking longer than usual, sitting in certain chairs, bending, or climbing stairs. You are not committing to doing it right now. You are simply choosing one example, so this skill has something concrete to attach to. Now, with that movement in mind, try one small shift in perspective. Instead of asking, "How much can I do?" ask, "What amount could I do and recover from comfortably?" That is your baseline. It is not the amount you can push through. It is the level your body can settle from without feeling more stirred up afterward. Once you have that baseline, choose one simple way to measure it: time, a turnaround point, or a small number of repetitions. Before you begin, decide on your stopping point while you are calm. Finish while the exercise still feels workable rather than waiting until you are worn out. Making that decision ahead of time prevents many flare-ups that happen in the heat of the moment. There is nothing to prove here. If fear or tension rises in anticipation, that does not mean you are fragile. It is a normal protective response. A nervous system that has been on alert often prepares for danger early. Pacing gives it a different kind of evidence, a plan that ends well. This is also where pacing and gradual exposure meet. Exposure does not require pushing into fear. It means approaching the movement in a scaled version your system can digest. That may mean doing less, going slower, or adding more support. The goal is not to eliminate all sensation. It is to create an experience your body can handle and recover from. During the activity, keep your attention steady and simple. Notice your breathing, your pace, and whether you are adding tension that is not needed. If discomfort starts to build, adjust the dose instead of ignoring the signs. That is not a setback, it is part of the skill. When you finish, give yourself a clean ending. Pause for 2 breaths and let your body register that you did what you planned and that you are done on purpose. Ending matters. A session that ends in steadiness is easier to trust next time. Afterward, you can check in with one simple question. Did this settle back to my usual level by the next day? If it did, that dose fits for now. Repeating it a few times builds reliability. If it did not, take that as information and adjust the next attempt. That is pacing in real life. Calm feedback, small changes, and consistency. Over time, this steadier rhythm can replace the cycle of overexertion and withdrawal. Each manageable step is evidence that movement does not have to feel like a risk. Take one more slow inhale and exhale fully. As you carry this sense of steadiness back into your day, remember, choose the dose you can repeat, not the dose you can survive.